Welcome to the NICE podcast on assessing and diagnosing autism in under-19s. The podcast is produced for NICE by the Social Care Institute for Excellence, or SCI for short. I'm Kim Rutter from SCI, and I have a number of years' experience in implementing NICE social care guidance. The podcast will focus on how practitioners responsible for assessing and diagnosing autism in under-19s can ensure that young people and their families have a good experience of the process. Our guest today is Jenny Drew. Jenny, could you tell us a bit about yourself, please?
Hi Kim. As you mentioned, my name's Jenny Drew. I currently work as a mental health practitioner in the West Midlands within a child and adolescent mental health service, often known as CAMHS. In this role, I regularly work with families where autism features, with and without a diagnosis, and often advise families on referral for autism assessment. Before my current role, I worked in public health, based within a large local authority, working with NHS, social care and voluntary sector partners on a range of projects, including developing a new all-age neurodevelopmental pathway for our area. That project included improving assessment for autism for children, young people and adults, and I undertook research on people's experiences of the assessment process. I also have some personal experience with the assessment process in supporting my son through it, and also several families in being assessed. So the various experience led to me being involved in developing the quick guide for young people and their families that we're talking about today. One thing I wanted to mention from the outset is how live the language debate is currently when it comes to talking about autism, as thinking about autism's developing. So lots of people identify as being autistic in that they see their autism as being intrinsic to their identity. That's with and without a diagnosis. Some people prefer to talk from what we might call a person-first perspective, so might describe themselves as having autism or having a child with autism. There's no consensus. So in putting young people at the heart of the process, one of the things I want to flag briefly here in the podcast is the relevant professional doing a bit of reading around use of language. For example, the National Autistic Society's research on it. Then asking the people they're working with what their language preferences are and using those in the same way that they'd respect the gender pronouns an individual uses.
Thanks, Jenny. That's really helpful. Why would a young person be referred for an autism assessment, and what questions might they and their family have about the process?
So a young person might be referred for autism assessment if they or people in their life think they may be showing signs of autism. These include, but aren't limited to, developing more easily in some areas than others, having unusual or intense interests, experiencing sensory differences, so finding some aspects of touch, noise, smells, taste, textures and lights difficult to deal with, strongly preferring a set routine and finding change difficult, and finding some situations and experiences difficult to cope with. In my son's case, we were especially interested in understanding more about the sensory differences he was experiencing.
What should happen once a young person has been referred for an assessment?
So while services vary significantly around the country, if they're following NICE guidance, assessment should start within 3 months of referral. It should also be undertaken by a team of professionals who are specialists in autism. One person in that team should be the allocated care coordinator, and that means they're in charge of knowing what will happen with the young person's assessment and when, and answering any questions on it.
Thanks, Jenny. Going through assessment and diagnosis is likely to be quite daunting for a young person. What can the case coordinator do in advance to reduce any anxiety that they might have about the process?
For sure, everyone I know who's undertaken the assessment process has described it as hard and at times intrusive. So sharing information with families about what will happen in the assessment process and when in advance, as well as in appointments, is so important. This didn't happen in my son's case, which was difficult for our family at the time. It also hasn't happened in lots of cases I'm aware of from my research, so I hope practitioners listening will take the importance of clear information for young people and their families to heart. I'd also add ensuring there's enough time to answer any questions young people and their families might have at any point in the process.
And how can the team doing the assessment ensure that they are putting the young person at the centre of the process?
So I'd say that making every effort to understand what a young person's good at and what they're interested in is as important as understanding difficulties a young person might be experiencing. Equally, asking about specific worries a young person or their family might have about the process and next steps after assessment.
And if the team's diagnosis is that a young person does have autism, what are the next steps?
The autism team or case coordinator should meet with the young person and their family as soon as possible after the assessment and give them a written report saying what they found in it. If the young person and their family agree, they should also send a copy to other relevant people, such as their GP and school or college SENCO, for example. They might need to arrange other assessments to work out how best to plan what support the young person needs. The team should also give the young person and their family information about what autism is and what it might mean for them now and in the future, as well as details of when the team will meet with them next. This should be within 6 weeks of the assessment ending.
Thanks, Jenny. That's really helpful. I'm afraid that's all we have time for now. To find out more about NICE guidance on autism in under-19s and other NICE guidance for health and social care practitioners, visit the social care pages at nice.org.uk. You'll also find the NICE quick guide that Jenny mentioned, Assessment and Diagnosis of Autism, What to Expect, and other quick guides on a range of social care topics. Goodbye.
Thanks, Kim, and goodbye.